We're back. We're sitting down with Dr. Kevin Barrett. He's talking with us about the steps you need to have to recognize sleep apnea, what we can do about it. And before we actually try to recognize this, we want to know what it is that we should be recognizing. What is
Well, sleep apnea is the next stage, basically, above snoring. When you hold your breath for 10 seconds or longer and you cough while you're sleeping, you're choking. And that's sleep apnea if you do it 5 times an hour or more. And they can record these. It becomes very serious.
When you say, when you're holding your breath, people are consciously holding their breath while they sleep?
Not consciously, they're asleep.
Yeah.
And they don't even know they're doing it. And they just hold the breath, and they can do it as many as 100 times an hour.
Well, let's take a look at how sleep apnea affects a person. We actually have a tape of a person sleeping. Then I want to find out, like, what effect that could have if it's devastating or
Can you talk us through this?
Sure.
Yeah. Okay, here we go.
This gentleman's asleep, going through a sleep test, actually.
What's happening
It's
to
a
him
home
now?
test. Right now, he's snoring, and normal way air comes in and goes out. Now, when you see the tongue fall back, it obstructs that airway. You notice the air can't get in. The heart immediately tells, the brain tells the heart that you're choking and you're dying. So your blood pressure starts increasing. Now, can you imagine doing that 100 times an hour?
Isn't that dangerous?
It's so dangerous. It can cause heart attack, stroke, hypertension. In fact, you have 50% better chance of getting those with that.
Who's at risk here? Who are we talking about?
Well, people who are overweight, children, people who basically even are thin and just snore. It has to do with the makeup of their throat. In what we just saw, a simple show is the jaw falls back, and as it falls back, it blocks the airway. So that is why you have obstructive or blocking.
Is this something that evolves over time? Because you mentioned children.
Yeah.
Right.
Are they born this way?
No, as we progress in age, up to 50 is when it really starts kicking in, both in men and women. So your partner may snore and you may leave the room, but as you age and as you get older in a marriage, that can happen.
What if you're by yourself, though? Because I know that if you don't have a partner who can, like, shake you to wake you up, like when you're snoring, or if you have this, I mean, what can happen? Can you just stop breathing?
Well, that's a great question. People who snore and live alone usually don't know they snore. They don't know they have sleep apnea. And that's because they're asleep when all the snoring occurs, and all they do is wake up, but they don't hear it.
Right.
All right, so in front of you, before you here and us here today, are solutions to this? The way to deal with it?
These are ways to manage.
Okay.
You don't cure it, but you can manage it. It depends on the severity of your sleep apnea.
What's this
Well,
one
this
here?
contraption looks scary to
That
me.
looks
What is
severe.
that?
Well, that's sort of the main complaint. However, it is the gold standard of sleep apnea. And what it is called a CPAP, continuous positive airway pressure. It forces air with this compressor into your nose, down your mouth, into your airway.
You put this on at night when you're sleeping?
People wear that all through the night.
Every night?
Every night. Now, the problem is 50% to 60% of the people can't use it. It's called intolerance to it.
Sure.
So that's why they go to a dentist to get one of these types of oral appliances, which again, pull the jaw forward and down.
Okay, now I see you have 2 types there. The blue one looks a little bit more manageable and not as uncomfortable as the one on
Right.
the left.
This is, there are at least 200 kinds of these around. These are the main 2 I tend to use and most dentists use when it comes to sleep apnea. I wore this for about 20 years, and this is rather new, and it's very comfortable. This is what I wear now. It makes my wife very happy.
2 things. Because 2 things. When your mouth is like that, your jaw is no longer aligned the way it normally is during the day when your mouth is closed. So do you wake up with jaws that are sore? And also, another question is, because your mouth is open, does your throat get dry and do you need water?
Yes, to both sometimes.
Okay.
You can get dry mouth during the night. what you want to do, and that's why dentists that do these generally are associated with sleep apnea studies in schools, and we're very cognizant of the temporomandibular joint, which most people know about.
Right.
Are there behavioral changes? This looks pretty drastic. I mean, to have something like this, trying to sleep with that. Is there something before I would make that decision to go, okay, I'm going to do this behaviorally that I can? You talked about weight, or you?
Again, there's very few things you can do, but you can try it. Sleeping on your side, weight loss, and not drinking 2 to 3 hours before you go to bed.
Alcohol.
Drinking alcohol before, because that can cause
that can cause that, and it is drastic, and it depends on the severity. If you're those numbers again, if you hold your breath 90 times an hour, you are going to have a shorter life. You probably should do that. You know,
because you have sleep apnea.
I have a mild case. I'm a 10, and that's very mild. It's mild, moderate, and severe.
Sure.
Someone like James Gandolfini, perhaps, and I don't know, but he was a large man. He probably had sleep apnea, and it contributed, you know.
Wow.
Well, look, it's no alcohol, sleep on your side, lose weight. Those are the 3.
If you can do that first, right.
Give those a shot. If not, step in.
Right, and if you really don't know what's going on, talk to a dentist that's a member of the American Academy of Dental Sleep Medicine, or a medical sleep specialist.
Or you can go to lasnore.com, and you can check out more from Dr. Barrett, and he'll have some questions that he'll be answering on our Facebook page. Thank you so much for coming.
Thank you again.
Thank you so much
It's a real
for shedding
pleasure.
light on this. This is great. And when we come back, I've got tips on how to preserve those lemons I was talking about.